Good afternoon. Welcome to this session on how to accelerate mobile big data and AI services through public-private partnerships. My name is Janine Vos. I head up the SDG Accelerator at the GSMA, where we monitor the industry's progress against the SDGs, drive sustainable business practices, and fast-track mobile innovations for the global goals. And so it's a true honor to be back at the UN World Data Forum to moderate this session, where we will provide an update on the activities by the GSMA AI Impact Team in 2020 and discuss with our thought-leading partners how to build successful cross-sector collaboration and drive replication of products and services. So moving on to the agenda for the session today. The agenda is as follows. I will first provide a brief introduction to the session. If you could please move to the agenda slide. Then Catherine, then we'll have a panel discussion with 4 leading experts in this space. So Catherine Vogel of GIZ, the Deutsche Gesellschaft für internationale Zusammenarbeit, or GIZ for short. Catherine coordinates the GIZ Data Lab. Then Kate Wilson, who's CEO of the Digital Impact Alliance. Eric Mutonji, who is Technical Manager of ANICIS, which is the National E-Health Public Agency under the umbrella of the Ministry of Health in the Democratic Republic of the Congo. And Christopher Agran, who's Head of Data Insights at the Vision X of Telia. So first, I will provide a brief background presentation to the session of today. So moving on to the next slide, please. So for those familiar, the GSMA is the global association of the mobile industry, representing over 1,100 members and associate members around the world. Working closely with industry and partners, we undertake a wide range of programs and initiatives that really aim to realize our industry purpose, which is to connect everyone and everything to a better future. So under this umbrella, we launched the AI for Impact initiative in 2017, with the aim to scale up mobile big data analytics and AI for the SDGs. So we have an advisory panel of 12 UN agencies and global partners, including the WHO, UNICEF, UN Global Pulse, DIAL, GPSAD, the World Bank, and more, together with a task force of 21 mobile operators from around the world. So together at a global level, we are establishing a common framework for implementing mobile big data projects, defining the technical, the commercial, the ecosystem needs, and critically also the privacy and ethical considerations to deliver sustainable products and services. And then at a local level, in country or in cities, we work with operators, governments, and partners to implement projects and really drive cross-sector collaboration to unlock market opportunities. So what we mean with mobile big data analytics and AI, mobile operators are processing aggregated, non-identifiable mobile network data, combining this with third-party data sets, then applying advanced analytics and packaging this into meaningful tools that can aid government agencies in evaluating policies, planning, and decision-making. For example, you can combine population mobility patterns with weather data and infrastructure maps, or with disease incidents or hospital locations to develop decision support tools for emergency services, to quickly deploy rescue teams to the right location to save people during earthquakes and floods, dashboards that predict air pollution levels in cities so that municipalities can take preventative steps, or insights to help decide where to deploy critical health infrastructure to ensure maximum access to care. So we've worked with our operators and partners in all regions of the world on a wide range of these use cases. And then COVID-19 emerged and the WHO declared a global pandemic early in 2020. It has had a tremendous impact on people's health and well-being around the world and has changed the way we live, the way we work, the way we learn. And particularly vulnerable are those living with financial hardship, those that have health conditions, those that have limited access to care or other facilities, or those lacking social support, And so from the outset of the pandemic, the mobile industry has really stepped up to help people, businesses, governments, and vulnerable communities. And this is well beyond ensuring connectivity or managing the surge in network traffic. Operators have supported governments in disseminating health advice, setting up call centers, provided telemedicine and other critical communication services for hospitals, provided tools and content to enable home working and home learning, or lifted data caps so that people could continue to communicate with their loved ones. And similarly, operators have really, across the last 9 months, worked closely with their governments, provide them with AI and big data tools to help inform their decision-making in response to COVID-19. And we have seen examples all over the world, from Ecuador, Ghana, Italy, South Korea, Norway to Nigeria. Mobile operators have really put significant efforts and resources to fast-track these solutions, working closely with their local government. So moving on to the next slide. So how can these solutions help inform government response? So in the first phases of the pandemic, the emphasis tended to be on lockdown strategies. So for example, in France, Orange worked with INSERM, which is the French public research agency for human health, to help prepare and evaluate their lockdown measures. And not only did their insights show a 65% reductions in journeys during lockdown, it also highlighted unexpected results. For example, 20% of people had already appeared to have left Paris even before the lockdown announcement. So this illustrated both the careful need for planning of public messaging, but also the importance of really keeping up-to-date information as the pandemic progresses. So now as the pandemic evolved further, the focus has shifted to more understanding how people can safely return to their daily lives. Think about public transport, how to enhance safety or plan social distancing measures for the public transport system. When combining mobility insights with infrastructure and transport information, this can, for example, help understand the demand for public transport services and help ensure sufficient capacity, or help understand where to prioritize measures to ensure people can travel safely. Operators also have created or inputted into epidemiological models. For example, since January 2020, even before any cases were detected in Norway, Telenor has been working closely with the Norwegian government, with its COVID-19 task force, to help model the potential spread of the virus in order to help predict the number of hospitalizations, the number of beds needed, the resources needed, so that the medical system could be better prepared and plan accordingly. And further, mobile operators can also help build understanding of where, for example, social or financial support is needed, or where to dedicate further messaging. So, for example, in Nigeria, MTN worked with the Government's Forum to deliver a comprehensive dashboard to support needs-based interventions by state. So based on a likely number of cases and exposure, MTN estimated the number of vulnerable citizens who may require social support, and also identified the number of test kits, test beds, medical practitioners that were needed to more efficiently deploy aid and resources across the country. So what's the GSMA role in all of this? So from the outset of the pandemic, the GSMA AI for Impact team has been gathering these examples, has been capturing the knowledge, the insights and best practices, and has been promoting the privacy and ethical principles that should govern this work. And thanks to funding by the FCDO, AI for Impact is also working in 10 low middle income countries with governments, operators and partners to replicate successful approaches, develop dashboards for COVID response, and really build the skills and capabilities based on these global experiences. So for example, in the DRC, GSMA is leading a collaboration across governments, operators and partners to create dashboards to help the COVID-19 task force evaluate the effectiveness of lockdown measures and monitor health capacity. So moving on to the next slide. So what you can see is that there are a wide range of areas where mobile big data analytics and AI can support during the COVID-19 crisis, during the recovery phase, as well beyond. So moving forward, it's possible to build on the experiences, the products and services developed during the pandemic to address a wide range of government policy and decision-making needs in relation to the Sustainable Development Goals. So in our country projects, we are working very closely across the public and private sector, really jointly embarking on a journey to address the most pressing challenges, to enable replication, to build capacity across all stakeholders, all supported by sustainable business models and funding to really enable the investment in the required resources, skills, and system. So to discuss further the role of the public-private partnerships, I'm very pleased to invite thought leaders in this space to join me for the panel discussion. Great. So great welcome to the panelists, and thank you all very much for joining me. My first question I'd like to pose to Catherine. It's really a pleasure to have you with us. Could you explain why GIZ set up the Data Lab in 2019? Could you talk a bit more about the mission and the role in advancing data-driven decision-making by government?
Yes, thank you, Janine. Thanks to everybody for having me. It's a great opportunity to be at the World Data Forum and to be with such a nice crowd of people on the panel. So thank you. Yeah, so the GIZ Data Lab, as you said, was founded in 2019. GIZ is a technical implementing agency for international development. We work on behalf of the German government. And what we realized that big data was all around us and that there were huge challenges and opportunities, and we needed to leverage the opportunities and we needed to dive deep into the challenges for our development cooperation programs. And if we do that in a, let's say, traditional way, like we all work in not very unbureaucratic organizations, that can take such a long time. And that's why we decided to set up a lab where we can act really quickly, where we can learn, where we can test things, and then have the possibility to directly input into our development corporations. So this is one part. It's really increasing the use of digital data and data for development in our programs, but in the right way. So always having a look at the challenges, always respecting the safeguards, and put the user in the center of it.
Great. Thank you very much. Moving on to, we've been working together for quite a few years. Thank you very much for joining us. You've been working with governments primarily in Africa to help define needs and implement projects that leverage big data analytics. Could you explain a little bit more about DIAL's work and collaboration model? And thank you for bringing some slides to illustrate your points.
Thanks so much, Janine, and welcome to everyone watching wherever you are around the world. It's wonderful to be here with this panel and with you all today. Talk a little bit about our kind of collective journey, I think, to kind of using mobile data to help us all really achieve the SDGs. Just as a bit of a preamble, for those of you who don't know DIAL, we're a think, do, replicate tank that focuses on what some of the larger challenges are to safely delivering services everywhere in the world. So we look for common challenges that cut across multiple sectors. We look at how that technology can actually be combined together and connected so that there's better and more robust information systems that governments can use to actually help deliver those services. And our overall goal and belief is that for digital transformation to take place, digital technology, including the use of responsible data for development, must be institutionalized. It must be so easy for us to do this that anyone could just turn it on with the click of a button and feel confident that both their data is used in a protected way, but also that they can answer major questions that are preventing this. Next slide, please. So one of the areas that we've been focusing on for 4 or 5 years, and most of that time in deep partnership with the GSMA, so we're very we really welcome this partnership deeply, has really been on how do we unlock the routine use of mobile network data to answer development questions. Janine, you talked about both the sector-specific questions that could be answered, as well as that need to think of a global framework, and then think also about how to do it locally. And we break this down into, there's basically 4 problems and 1 key strategy that's needed. One of the great challenges is actually challenges of people's understanding. NGOs have struggled to understand how to use mobile data safely and effectively. Country governments have wondered, how do I actually incorporate this into dashboards that I have? Mobile operators are interested in doing this, but the business model may not have been there. So some of the first steps that we took, steps 1 and 2, were really to break down for those sector-specific questions what data was actually really most needed and could actually be shared safely and easily as mobile data analytics. We next looked then at what the business models were for that. So how could actually an operator such as a Telia, such as an Airtel, such as a Vodacom, start to look at this as actually a business that they wanted to be in, where they could do this and actually enter it into partnership, because they do fundamentally have that as a primary motivator. Then what we did was we worked closely with many country governments and local partners on the ground who are already using this data. And I want to just provide a quick example of work that we've been doing in Malawi, as well as many other countries, but Malawi helps illustrate this. So the government itself had some very specific health questions. Where should it actually put its new clinics, and how should they think about their capital investment plan? Working with our partners, Cooper Smith, Airtel, Macro, the regulator, and most fundamentally guided by the Ministries of Health needs, what we did was work with them to actually pull out mobile data analytics that they are now using on an ongoing basis to answer every question, but it will now increase their coverage of health facilities across the country. So it's an example of partnership, a 5th P that I think is really critical. Next slide, please. From there, what we've been doing is how do we think about replication? So once one ministry decides this is actually quite interesting, then we begin to look at how it can be expanded. In Malawi, again, the National Statistics Office has begun to adopt it. We also have invested very specifically in a few mobile data analytics platforms that are open source and algorithms that others can take and reuse. And then working with partners such as GSMA and many others, including FCDO and others, we've started to look at how we can actually do that in a policy and responsive way. So again, it's looking at the pricing, the policy, the people, the partnerships that are really required to make this all come about. And we're delighted to see that not only a number of countries working with our partners, but also countries such as DRC. Eric, I'm delighted to hear from you, and our partnership with GSMA in terms of some of the support there, as well as continuing this work in Mozambique and others. Thank you all so much. We're delighted to be part of this replication journey with all of you.
Great, thank you so much, Kate. Moving on to Eric, welcome, really a pleasure to have you join us. So the GSMA team has been working closely with yourselves, operators and partners in the DRC, and you've been truly pioneering the use of mobile big data analytics in decision-making by the Ministry of Health and instrumental in fostering the national ecosystem. So could you share some insights as to why you believe the Ministry of Health considered it so important to leverage mobile big data analytics, for example, in a response to COVID-19? And could you explain a little bit more about who you're working with?
Thank you so much for the opportunity. Primarily mission of the agency, which is very new in the DRC, was the development of the Congolese digital health transformation roadmap and standards. So we were assigned to streamline the national health system by usage of the best digital technologies and biomedical equipment to facilitate the provision of quality, effective and efficient healthcare for the population. Now, to standardize the ecosystem and of health industry, the nomenclature and all that, what we did, we first, because the agency was only launched in February this year, after 2 years, finishing the paperwork to put it on the government system, what we did, we sat with stakeholders and we were working on the policy to set up a dedicated and secure platform, for exchange of information, draft a master plan, for defining and integrated, national interoperability plan, because we got disparate systems here and there, to establish processes to ensure the collection and centralization of the data. And the COVID started. Now, when we're working on this thing, this COVID started, we said, what are we going to do? So the first thing we did, we started by, a website for COVID. Then we had a mobile operator puts a song whenever you call. You gotta, have a song telling you about the COVID and all the preventive measures. Then we had a chatbot with Facebook after 1 month development. We worked with Grid Tree on the GIS, Geospatial Information System, and we finally came to the big data opportunity. How it started is that in March already, the GSMA approached government to present, the opportunity of using big data, and some operators align their solution to tell us what they do already. So I personally got involved by, asking GSMA to put a platform where we sit around the table, and we've been so supported by partners such as Orange, Africell, and Vodacom, the GSMA, our godfather, and then we have Flowminder joining the team. And so this is how it came about. So we didn't know about the big data, but we were assigned a mission in the ecosystem of public health. All of a sudden, we have the COVID, then we have the opportunity for big data, and we've been groomed little by little, by all these entities. I'm here sitting with all the big names. I'm very grateful for that. That's all I can say for now.
Great, thank you very much, Eric. And I think also the fast progress that you've made in what is only a number of months. So thank you very much for sharing that with us. And finally, Christopher, thanks very much for joining us. Now, Telia is truly one of the global leaders in mobile big data analytics and AI, and you've been very quick to respond to the pandemic. So from the outset, you've been supporting a number of governments in the Nordics to inform their response to COVID-19, and you've realized also some critical in the media. Could you explain a little bit more about your approach and the role that Telia is playing?
Sure. Thank you so much for inviting me, and it's a true pleasure to be part of this panel. So Telia, even before COVID, we had a suite of products in the mobility analytics area called Crowd Insights. And it provides anonymized and aggregated insights on people mobility in our markets, which is the Nordics and Baltics. Normally, we serve verticals like urban development, smart cities, public transportation, retail, smart buildings, real estate. And during the pandemic, we very quickly took additional steps and made our solutions available to governments and institutions within the Nordics and also in Estonia. We have also chosen to be very public and transparent about this. So we are also supplying weekly statistics to the public and media. It's freely available on our websites, and that show overall mobility, actually, aggregated high-level statistics per country. So you can find it for Finland, Sweden, Norway, Denmark, and Estonia.
Fantastic. Congratulations on your work there. So now I would like to delve a bit deeper into the ecosystem approach that each of you have been following. So Eric, you mentioned, you've been working with quite a range of stakeholders. You've been really instrumental in driving the efforts by ANICIS and the Ministry of Health on mobile big data analytics. So from your perspective, why is this cross-sector collaboration so fundamentally important, both during COVID-19, but maybe also looking a bit beyond? Eric, you are on mute. I'm sorry, I fear we've lost Eric. So then I'll move on to Kate. So Kate, throughout your work in Africa, you're really following an ecosystem approach. So could you share with us some of the lessons learned from your engagements? And particularly, what are some of the key aspects to ensure successful ecosystem collaboration?
Thanks so much, Janine, for that question. It's a shame we can't hear from Eric, so hopefully he'll be back soon. I think for us, really, the key thing has always been start with what the government most needs and where they actually need to direct the questions. So if there's a very pointed set of questions, I think we're around the world, helping educate and bring along people to, what is actually possible with the use of mobile data for development and the use of AI on that. And that we need to start with very specific questions that they want to see answered instead of it being an experiment that is done for, a research benefit, as beneficial as that may be. So I think COVID-19 offers a very specific opportunity for people to really understand the power of mobile data for development, but also understand how the same data that is used to answer where should you put a health facility, where should you deliver vaccines, what types of supplies do you have, that those data elements that are needed actually can be used for multiple things. So I think first it's helping the government, as Eric was even elaborating on, sort of understanding where that is. Then I think it's about, helping operators really understand what are the challenges that their government counterparts are facing, what are the questions that they most need answered, and then being able to work deliberately and delicately with regulators to try and find that balance between when we're protecting citizen safety, but we're also using data analytics for it. I think the last and certainly not least is work with the existing partners on the ground. So we deliberately did not go in as Dial per se, but worked always through development partners who have really led the charge because they were already investigating in health or agriculture or in humanitarian services, what was the data needs that were needed. So we supported their work because we believe that they will be there long after this approach sort of ends and that they will continue to have these deep relationships with the government. I just want to give huge credit to our partners such as PATH in DRC and Tanzania, partnerships with Cooper Smith in Malawi, partnerships with Dolberg Data Insights in Uganda. Those have really been sort of the cornerstones of how we've actually worked with a number of them. And then ultimately, the last and certainly not the least is actually the statistics offices, because I actually think that a lot of those statistics offices will eventually take this over. And so by starting again with this government-led approach, I think we can set up a set of tools and services and data analytics that actually allow the ecosystem to then be controlled and directed by the government and what they need to deliver services to their citizens.
Great, thank you, Kate. So it's really about, delivering to the local needs and building the local capabilities through relevant partners that you're realizing your successes. So moving on to Catherine. So you are working on pilot projects that you then replicate across a wide range of markets. And one of those regions is also Latin America. Could you provide some experiences from your work in Latin America? And particularly if you were to pick one aspect where ecosystem collaboration is a game changer, what would it be?
Thank you. Yes, indeed, we work in all over the world, and we have a couple of pilots running in Latin America. For example, we work applying the data-powered positive deviance approach. We work in Mexico to define spaces which are safer for women than those spaces which have the same preconditions. So we're looking for the local good examples for safe spaces for women. And we're doing this obviously by using mobile phone data, like the movement data. That's an excellent contribution to this. And here also, we couldn't do this like just with the data or just with our algorithms, etc. What we need is a strong partnership on the ground. For example, in this case, we work with the city of with Mexico City and with local stakeholders. We have a ethical committee established for our gender-based violence pilot, which is very close to that one. And so it's really about bringing those different perspectives together in order to have an overall approach which really benefits, at the end of the day, the people which are on the ground and which we actually work for. And thanks, Kate, for bringing this up. It's really not about only having experiments or pilots. It's really about then already from the very beginning designing it for scale, designing it for being able to replicate it, for example, in this case, all over Mexico and Latin America. It's actually this experiment on gender-based violence, which we're doing with the Data Pop Alliance, and they bring their partner Cubic into play. And so this is a very good example. It's already been taken up in 2 other Latin American countries, which is Colombia and Brazil. So it's really about already from the very beginning designing your projects in a way that it can benefit to a bigger range of people all over the continent.
Great, yeah, I like that. Designing from the outset for scale and replication. Thank you, Kate. And Christopher, you know, from the outset of the pandemic, you've been working closely with different governments in the Nordics and in Estonia. Could you share a little bit more about your ecosystem collaboration model and any recommendations you would like to share with the audience?
Yes, thank you. What I think you have to understand about the Nordics, if you're not from here, is that really a common theme across the Nordics is the absolute need for transparency and a high focus on privacy and ethical aspects. So it's not really possible to start with to play in this ecosystem at all without taking these things very seriously. So we have to, of course, and we chose to be transparent about what we do, and we take new cases very seriously, also from an ethical standpoint. We often do broader risk assessments, like involving academia, legal community, human rights specialists, and so on. So when we talk about this and we show what we do, that I think that gives us the ability to at least be heard. And during the pandemic, we've had really good collaboration with authorities in all the Nordic countries. In Estonia, we started on a philanthropic model. And offering also the existing solution, and really having an existing GDPR compliant solution has been key for us. We would not have been able, I think, from a privacy and ethical standpoint to just simply build and evaluate it properly in the short amount of time had we not had it already. So having that solution already has been really key. It can be mentioned as standard, and we have made small customizations. I think it's also helped the authorities to be able to stop there and not demand privacy intrusive measures to get mobility, rather to get the mobility data, but rather you could actually use the things that we already had in our market. So I think that has been the key for the quick uptake that we've seen in the Nordics.
Great, thank you, Eric. Yes, you raise another very important point to ensure privacy and ethical approaches are being followed, and really to create that trust and transparency in your solution is also another key aspect to drive and enable replication. I see that we have Eric back online. So Eric, just reposing the same question to you. You know, you're really instrumental in leading the collaboration by NICs, the Ministry of Health, and other partners. So it would be great to see your perspective on why ecosystem collaboration is so fundamentally important, both during COVID-19 as well as beyond.
Thank you so much. My apologies. We are in Africa. The network is not always the best. It was very important to have all the stakeholders on the table, but you see, you need to gather yourself with specialists of the domain. So GSMA and the other stakeholders help us to build a stronger understanding of how and where mobile big data can add value. Because you see, we had an initial workshop in March, but it was just a presentation. Now we had to sit and understand where mobile big data will add value. So GSMA helped us, to coordinate with mobile operators, and they also coordinated the other stakeholders. Now we had the support of other organizations. It was very important for us to have various sectors of the industry and the public officials, of government bodies, because now everybody has got an angle, everybody's got a need. Now, when we understand that need, we put it together around the table, and we can build use cases. We can add value to government decision to fight the pandemic. And that is how really it was important first to have all the different people around the table. And that is how, as I said, we came about today to give value to the response of COVID by having some dashboards, for the hotspots and other use cases. Where I see this going in the future, I'm sorry, I'm a French speaker by birth, so pardon my very French accent, and I'm trying my best. Where I really see this going is that first, across government bodies, not even the health ecosystem, we can use mobile big data to make decisions tomorrow, informed decision, because mobility and other parameters of big data can assist government to make decisions. And also other stream of the economy can capitalize on the mobile big data manipulation for informed decision tomorrow. So this is really the value that we added in the ecosystem of the public health with other epidemic also that we can have tomorrow. We got Ebola in the Congo, we got other, malaria has been there for decades, and mobile big data can really assist to make informed decision and allocate resources and really fight this pandemic.
Thank you, Eric. And you explained very eloquently the value that mobile data analytics can provide. And I really like that phrase, the decision making for tomorrow. So maybe that's a good hook to move to the next thing, which is really thinking about replication, which is really key for long-term sustainability. So really thinking through, where can models be replicated, or where do they maybe need to be adjusted to suit the needs of the market or the particular challenge at hand. So Christopher, let me start with you. You've explained, you've been able to build on an existing solution, build on that to develop your solution and products and services for COVID-19. So where do you see this work moving forward? Where else do you see it's possible to replicate or build on your existing products and services?
Thank you. As more and more organizations become aware that it is possible to get these mobility insights, we see new cases popping up all the time, actually. And I think this is in part due to the fact that we've been so public about the information that we're providing. So it's also spread the word of what mobility analytics is and that it is completely safe to use. I think my favorite one recently is within water management. As mobility has changed in the Nordics, as it has in the world, so as the demand for water. I know data is now being used, for example, in south of Sweden to better forecast water needs. This was not a use case that was really had any traction in the Nordics before. And forecasting water is essential, of course, to ensure a reliable supply of water in a region. And this is an example, as it's now becoming known that this type of data can be useful also past COVID. And as often the case when we go to our customers and organizations using our data, it's often not the data that is the hard part. It's people changing their ways and changing your business process and becoming data driven. That is the thing that takes time. So with COVID, it has kind of accelerated, and a lot of industries have been forced to really change. So I think this has, in a way, mobility analytics, I think, have been accelerated a few years when it comes to the actual number of use cases. But certainly, I hope that the health authorities and regions who have used our mobility insights to just keep track of mobility for the sake of COVID will continue to do so, as they're now aware that it exists and they have learned how to work with it. You can use it for epidemiological models also in the future. And when it comes to replication beyond our footprint, we're making available also these mobility insights offering for licensing to other operators. And specifically regarding our collaboration with the Swedish Public Health Agency, we're actually now working on a joint article that we will be publishing to cover lessons learned from both ends and on how this collaboration came to be and how the insights were actually used by the Swedish Public Health Agency.
Great, thank you, Christopher. And wow, water management, yes, it's a very relevant use case across all regions of the world, really. So moving to Kate, could you share with us a little bit more about the model that you're using to drive replication? Could others adopt a similar framework?
Thanks. I actually think we probably all are, right? In terms of adopting a similar framework. So, I mean, the way we think about it has really actually been eloquently described by Christopher and Eric, which is, I think first you start with people's understanding and bringing together the right people and partnerships to make that happen and building trust. Because I think both touched on it and Christopher really used sort of like the transparency, building the trust, as did you, Janine. And so how do you bring those pieces together? And that's bringing together all the stakeholders in the group to actually understand what they don't understand about the other. I think the next part of it is actually having a set of platform product options that one can choose from. Eric mentioned FlowMinder, who we invest with. Christopher mentioned Telia's model. Opal, there's dozens out there and one can pick a variety of them, and there should not be one product that's possible, but there should be products that can be built upon, and the algorithm should be far smarter. And then we should be able to understand which questions then tie into that. And so we talked about health and water and, sanitation, and I see a deepening understanding already, even across this panel, of the degree to which the same things can answer multiple questions. And that's changed dramatically since we all entered the space even a couple of years ago. And then I think it's really getting the policies right. So what things are safe to share in terms of mobile data analytics and making sure people really understand that, and which ones aren't and should actually not actually be listed out. And that there's an increased dialogue around that so that citizens feel comfortable with how their information is being used in terms of anonymized and data analytics. And then last but certainly not least, I think, is actually making sure that that there is in fact in place, what we call a pricing or a business model that actually makes sure that this can be used on a long-term basis. Because fundamentally there is a cost in producing a lot of these data analytics, and they can be built in such a way that it is not incredibly expensive or exorbitant to do, but we must not ignore that there is a human cost in time, and the only thing that's going to move us past, the land of experiments is, both deep government ownership and then actually making sure that there's a sustainable business model make sure that we can keep doing this.
Yeah, makes sense. And so moving on to Catherine. Could you share a little bit more about how you approach new use cases and how do you leverage then the knowledge and experience of previous projects into those new areas?
Thank you. Well, we have different ways of approaching use cases. Sometimes we come from a data perspective, so we have a data set which seems to be very promising. Very often we come from a problems perspective, so like people just ask us to try to support them in one kind of specific problem, like for example, obviously with COVID right now. And sometimes we come from a solutions perspective, so we're really looking for concrete solutions, as I already talked about the data-powered positive deviance approach, where we're looking for already existing solutions out there through the use of mobile big data and other data sources. And but in order to do that and to replicate that, it's a little bit the roles are a little bit turned around here, but I really would like to spread the word on the digital principles from the Digital Impact Alliance. which GSZ has endorsed. So we always, as I already said, design for scale, but also really understanding the ecosystem and then design with the user. And so whatever we want to replicate, we need to always involve the user in the new context we want to replicate it in. Within GIZ, we're really lucky to have one big strategic project which only focuses on the scaling up of our of the products of our experiments. So there is an umbrella which takes up what we have developed and brings it into new use cases, new countries, etc., etc. So and whatever kind of partnership we build up there, we try to expand it to the other partners. Opal was already mentioned, a couple of others which we have worked with in one country and then try to replicate it in others. So this is really about the digital principles and putting people in the center and always having the ecosystem where we're going to leverage it into and replicate it into on board.
Great, thank you, Catherine. And finally, Eric, you explained how you're working closely with different partners in the DRC, and that you see real value of leveraging mobile big data analytics in the current response to COVID-19. Now, where do you foresee you could leverage some of that knowledge and the products or services that have been developed, other areas of interest to the government in the DRC?
Well, the first thing that I will never want to lose partnership, because federating all the skills together, putting everybody around the table has given us such a momentum. And I think this is a great team that I would like to keep together. I'm, willing to have regular meetings with all the parties that have been sitting with us for months now. And I want to speak to government officials, decision makers, to validate my proposal in such a way big data will not only serve for the health system, but we also serve other government bodies. So we're going to have a campaign where we go from departments to departments, and then we explain what we have done and how it can add value to the work that government does. So really, I want to keep the winning team, and also for the pandemic, because we don't know what's going to happen next. We want to continue working, for example, for the dispatch of resources, for the logistic and infrastructure planning, the watch dashboard, which is the hot topic that we've been working for last couple of days with other use cases that we are trying to put together on the hotspots. Hospital placement, resources. We're going to continue working for the pandemic. We're going to continue working in projection of other diseases as well. And as I said, this strong partnership, I'm going to put this proposal to government officials, because I believe we have found the right partners. Kinshasa Digital, our strategic partner, it's an academy with 42 developers. All the workforce puts for Anisis, our agency, and that has been tremendous. They mastered the Flu Vision from Orange from the first day, and then they absorbed all the other technologies and aggregated data, format that were proposed by other accelerators and specialists. Now we have also Flowminder, who's really a friend, a partner. We got GSMA, our godfather. We got the operators. So I think this is a winning team. We're going to really keep them together for the vision that I've just explained now.
Fantastic, fantastic. And we really look forward to continue working with you. And very nicely you outlined the journey that you're literally on to move from department to department to see where else mobile big data analytics and experiences you've had can add value. So thank you very much, Eric, for that. So that brings us nearly to the end of the session. I'd like to pose one final question to wrap up. So in our discussion so far, we've mainly focused on ecosystem collaboration and replication, and through that we picked up some subjects along the way, such as trust and ensuring privacy and ethical approaches. If you could pick one additional key success factor or core recommendation for the audience, what would that be? I'd like to start with Catherine.
Thanks, and thanks for this opportunity. Actually, there's one thing which really always goes very much to my heart, and it's the question of including gender data in whatever we do. So there are a lot of actors who already work on this, and some of them are on the panel, and it's great that there are a lot of resources and that there's attention to the gap of gender data. But I really think that an ecosystem approach is needed in which the private sector, but also governments and NSOs, et cetera, can work together to find new ways of closing the gender data gap. And this goes far beyond just the disaggregation of data, but it's about reflecting women's and girls' realities, about designing our interventions right. I always say that when we design our interventions, when we compare it to building up a skyscraper, we always take a lot of pay a lot of attention to like nice windows, which might be our partnerships, or nice elevators, which might be our activities, etc., etc. But if we don't have the foundation right, which is the data, then it's always going to be shaky, and it's always going to risk to fall. And for me, like really, the foundation of every development intervention is that inclusive data set, and we really need to jointly work on including the women's perspective in all our data sets, especially since COVID has actually turned down a lot of the progresses we've been making in the last couple of years regarding gender equality.
Thank you, Catherine. Kate, one more critical success factor.
For me, it would be invest in local leadership and capacity. It really touches on what Eric said earlier. You know, we have a lot of the models in place. We have a lot of the partnerships in place. We have some of the products that will make this easier. It really requires, you know, help at the local government for support for Eric, champions like Eric, and for developers that he's talking about investing in. That's when this moves from being something that comes from others or being an experiment to being something that actually is institutionalized in the context of government. So my focus would be, how do we make sure that we are really investing in the training and development of champions and leaders?
Great, thank you, Kate. Eric, one final recommendation or key success factor you would like to share?
Well, the simplicity that we approached the initiative with, I think, was very instrumental. Our advantage in Africa, as I said, even our primary healthcare system, which relies first to the people, on the people, it's a system whereby you got preventive measures, you got campaigns, you got education, so that you don't spend too much with the healthcare system. Our simplicity of getting knowledge from those who we believe have it, I think that is very key, because the issue with knowledgeable people, they are not really open, you know, to listen and get more information. So I would say simplicity in your approach. Be open to get more insights from other people. You've been maybe working. I've been listening, you know, and I see the expertise that is here is extraordinary, and I see tremendous work that have been done in other countries and other continents. So Africa is really late, but our advantage, we're going to capitalize on your achievement and make a leapfrog, you know, to be put on some standard. So I don't know if the advice applies really for knowledgeable people like the one that are here with me, but I think collaboration, openness, you know, and simplicity is key for making a success of the value added with mobile big data. And you need to let the minds go. You need to let people express themselves, and you'll be really surprised on how the human brain can suggest other approaches that you never thought about. This is how I was very pleased to sit in the meetings and just listen to people. Even my own people, I didn't suspect that I have such capacity in analysis, the people that I lead. So I think, yeah, just be open. You'll be surprised on what you can do with analytics for the future. That's the advice I can.
Great. Thank you, Eric. Openness, simplicity. Thank you. And Christopher, final thought from your side.
Hard to complement all the good success factors and ideas already shared by this passionate and optimistic panel. But I guess my contribution here is sustainable business models. And as someone who has actually worked with this and productized it for a few years, I must say that delivering quality data insights continually to support evidence-based policy making, for example, which we talk a lot about now with COVID, is really no small feat. And it involves technical aspects, skill sets, but also service design, understanding the problem, figuring out the privacy, risk assessments on the ethical side. So I think it's really key to be transparent about the costs involved to users of this mobility insights, even if you start in a philanthropic mode, which we have done in our markets, for example. But if you want to look at it from a longer term perspective, it has to be a sustainable model for all parties. And kind of following on what I think Kate said, there is I do believe that it actually figuring that out is key to make it past the experiment stage.
Yeah, agreed. Thank you very much, Christopher. And thank you very much to all the speakers. Unfortunately, we have to wrap up here. So thank you very much for sharing your expertise. Also, we'd like to thank the audience and all our operators and partners around the world who are leading impactful work on mobile big data analytics and AI. So just leaves me with a couple of brief key takeaways to share. So we've heard about the importance of replication by design, so scaling by design from the outset of setting up your projects and initiatives, closely engaging demand side, so working closely to understand the needs, the local needs for mobile big data analytics. And then, of course, wrapping that all in privacy and ethical approaches. This is really paramount. And just to note as well, the GSMA has published a range of guidance and principles around privacy and ethics for AI and big data. So please go to our website to download that if that should be of interest. Now, of course, all this work does require significant innovation and investment in people, skills, resources, systems. And so sustainable business models are fundamentally important to ensure long-term success of these solutions. And to also drive that long-term replication of products and services across many use cases, across many government departments. And to realize all of this is why public-private partnerships are so essential. So for us, the GSMA, we continue to capture and acknowledge insights from our work. And so we have a toolkit available on our website, as well as blogs and other materials where you can keep up to speed on our activities in COVID-19 and well beyond. And we've also launched a capacity building program last month, particularly focused on government and regulators to help us with a further skills development for those that are interested into that. So for now, rest me to say thank you very much for your attention, and wishing you an insightful continuation of the UN World Data Forum. Thank you all very much.